If I say the word menopause, what comes to mind? Now, if I say the word perimenopause, what are your thoughts? Many women may know the basic idea of menopause, but have questions about what to expect, even what's considered normal. Dr. Gerard Pregenzer is an obstetrician and gynecologist with Somerset Medical Center. He's here to help clarify what happens to a woman's body during this change in our lives. Thank you so much for being here today, doctor.
Thank you very much for inviting me.
Quite honestly, I wasn't even familiar with the term perimenopause. I was familiar with sometimes people say premenopause, postmenopause, and of course menopause. What is perimenopause and how is it different than menopause?
Okay. First of all, menopause is defined as the inability of an individual to ovulate. We arbitrarily define that as 1 year without a period. The transitional time, that is leading up from the minor variations in individual cycle up to menopause, is the definition of perimenopause.
Really? Now, what age might that start?
Well, generally speaking, it's somewhere around, and everyone's varies a little bit, somewhere around between age 35 and 45, but average age around 41. In North America, the average age of menopause is about 51 to 52. So it takes about maybe 5 to 7 years to go from perimenopause to menopause.
That's a long period of time.
It is indeed.
Because you're not menopausal, you said, until after you haven't had your cycle for a full year.
That's correct.
So perimenopausal, what are the symptoms that you might experience during perimenopause?
It varies, and it can be a particularly confusing time in an individual's life. Typically, the hallmark is a change in an individual's cycle. They become a little bit longer. And one of the main factors involved with perimenopause is that the individual is having more difficulty ovulating. So the body's trying to work extra hard to ovulate. So an individual's estrogen level, the female hormone, increases dramatically. So those areas, those systems...
I did not know that. I did not know that, sorry to interrupt you, but I did not know that your body's actually working harder to do what it's typically used to doing or what it's supposed to do.
That's
and
correct.
That your estrogen levels rise. Now that's why you get the side effects that we hear about so many times, such as the hot flashes and things like that.
That's exactly correct. That's exactly correct. So basically, if you can look at it, if your hypothalamus, the part in the brain which controls this cycle, if it's becoming hard of hearing, you always have to sort of shout. So your body is making more estrogen.
So you got those shouting ovaries. They're what's causing the...
You do, and that can sometimes that shouting can drown out other senses. It can be very confusing to an individual. So cycles typically become a little bit longer. They may become heavier. Breast tenderness typically becomes more common. An individual's breast size typically goes up 1 to 2 cup sizes somewhere between age 40 and 45. And that
that's something to look forward to.
Well, for some people, but
True.
for many people it's confusing, it's upsetting.
Yeah,
they're concerned, could this be breast cancer?
That's a very good question. I want to talk about some of the other symptoms, but I also do want to reference the fact that these could be confusing symptoms for someone to be experiencing.
Absolutely.
And how do you tell these symptoms apart from possible disease that you might have or another problem?
Well, that's why we believe individuals should talk with a healthcare provider to explain. First of all, in terms of breast tenderness is usually related to these estrogenic changes. Breast cancers, unfortunately, for the most part, are not painful at all. When we see an individual for a lump which is painful or uncomfortable, we actually in a way say, thank goodness, because in a way that's a good sign. It's not a nice sign. When somebody comes in, and if they ask us, we have a painful lump on one side, and we're more concerned about the one on the other side, the one that doesn't hurt, and they say that's been there for years, that concerns us more, because breast cancers, they grow very slowly.
So if it's sore, if it's tender, there's less of a chance that you need to worry about it. And of course, you need to get your yearly mammograms, but
Absolutely.
If you're concerned about something like that, that tenderness usually means it's a sign of the perimenopause?
Yes, that's correct. That's correct.
Huh. Now, sleep. I've heard about, and I have family members, my aunt, talking about waking up in the middle of the night, difficulty sleeping, or the sleep cycle changing, patterns changing. Is that typical with perimenopause?
It is. Very much so, it is. Some people will have hot flashes, which can occur at the time of ovulation. There are also more double ovulations during the perimenopause. one can still get pregnant. We see a lot of twin pregnancies during this time period.
Oh, really?
Yes.
You can now. Is that a typical myth that people believe? I'm perimenopause. I'm getting the hot flashes. I'm getting this and that. There's no way I can get pregnant.
That is indeed a myth.
It is a
We
myth.
should dispel that very quickly. That is indeed a myth.
I'm sure there's a lot of surprises.
I believe over half of the unintended pregnancies in this country are people in the perimenopausal age period. So it's a very significant health concern.
Wow.
Over half.
Over half.
So these time periods when people have double ovulations, they typically have hot flashes. When the hypothalamus is not hearing the signal and there's that confusion between the ovaries and the brain, you can have hot flashes. That can wake an individual up. Also, there are changes with the sleep cycle. We have a normal circadian rhythm where people tend to go to sleep at a certain time. And most of us in the 20s and 30s typically will get up around 7:30, 8 o'clock, a normal cycle. As we get older and enter perimenopause, it tends to be earlier. So a sleep cycle is changed quite significantly.
And how about mood? Mood changes and maybe, I don't want to say personality changes, but a tendency, I don't know, what are the typical symptoms related to mood?
It can indeed, mood changes. I mean, just imagine if somebody has a disrupted sleep because of hot flashes, maybe only getting 2 or 3 hours of sleep day after day, night after night, certainly you're going to be fatigued, and that does wear on you. During these time periods when you have these double ovulations, you produce more of another female hormone called progesterone, and that's what is responsible for the fluid retention, the irritability that people will have, the bloating, the intestinal activity slows down, so you fill it with more fluid in your intestines, so there's more of a bloating sensation. And this is not them. This is the perimenopausal hormonal changes, so it's not them.
You're normal. It's okay, and it's typical for women going through perimenopause.
Absolutely. And that's
I think
why
that's so important for women to realize, because I don't think there was a lot of conversation about menopause years ago. And I think it helps now to know this is okay, what's going on with your body is normal.
That's correct. We spend a lot of time, certainly in our practice, educating patients, and I appreciate forums like this to let people know. Patients who are going through this, they're not losing their mind, they're not going crazy, and typically in this country we see people delaying childbearing. So when people have their children when they're mid-30s or early 40s, as they're going through perimenopause, their children are going through adolescence, and that can be a very significant clash. So we see a lot of people who are upset and disturbed with these changes, thinking that they are losing their minds, that my family says, they still love me, but they don't like me anymore during this time period. And we tell them it's not nice, but it's okay. These are normal changes.
Because it changes, and you're both in those different stages. Now, when we're talking about something with the moods, I'm wondering, I have a tendency to get a little bit moody around my cycle. I imagine that's about the hormones and things like that. Is that a good, what's the word I'm looking for, sign of what I might experience in perimenopause?
Hard to predict, because with perimenopause, there's a larger fluctuation of an individual's hormones, and it depends. Some people handle it very well, others don't.
I'm sure I won't handle it very well.
What's interesting, we find that most people who are on oral contraceptives, some form of hormonal contraception, they rarely go through these changes.
That's interesting. Are there other ways to prevent the symptoms or treat the symptoms of perimenopause?
Deal with the symptoms.
Deal with the symptoms.
First of all, we find first and foremost the understanding that, again, they're not losing their minds, that these are normal changes. We recommend diet, nutrition, exercise always. So we recommend a high-protein diet, and everyone should get exercise. Getting a good night's sleep, which is just very important. And if they find that this is a quality of life issue, that they're really having difficulty, it's not just 1 or 2 days where I'm not myself, but it's a week or 2 weeks out of the month I'm really not myself, then we talk about pharmacologic or other medications to help with that.
Wonderful. I've heard a little bit about, actually a lot on the news, debate about hormone therapy. Any thoughts on that?
Yes. First of all, I think it is very safe when used judiciously. There's a famous study in 2002 which basically said that this may not be that good for you. And that was a very confusing study. It's difficult for clinicians to sort out. I think what it basically taught us is that hormones are not for everyone. It's not good for you if you're morbidly obese, if you're a smoker, if you're hypertensive, etc. But I think if otherwise an individual's otherwise healthy, I think the usage is very safe. And if you look at the magnitude of difference, if you take your typical birth control pill and basically chop it up into 12 equal pieces, hormone replacement is basically taking one of those.
Really?
So it's minor.
So it's definitely talk to your doctor about it.
Absolutely.
And that's an interesting way that you put that. It's like chopping your typical birth control pill into 12 pieces and taking just one of those little pieces daily?
Absolutely, yes.
When it comes to a hysterectomy, will you immediately go into perimenopause or into menopause automatically?
That's a good question. First of all, hysterectomy...
I try to only ask the really good questions. Okay.
You're very good. Medically, hysterectomy refers to the uterus only. When people talk about a complete, we know what the general public is thinking about. They're thinking about also having the ovaries removed. So if we're talking about removal of the ovaries, the source of the estrogen. An individual does not go into perimenopause, but they go directly into menopause within about 3 to 5 days after the surgery.
Really? But that's not for a typical hysterectomy, which is just the uterus?
If it's hysterectomy only, that's only the uterus, and there is no going into menopause or perimenopause right away.
Because the ovaries are what are controlling or receiving the messages from your brain to control this whole phenomenon.
Absolutely correct. That's correct. That's right.
Thank you so much, Dr. Pregenzer. I know you answered a lot of questions today. You brought up questions in my mind that I didn't even know I was going to ask, and I really appreciate it. So thanks for coming in.
I appreciate it. Thank you very much for inviting me.